So today we're going to run through a Q&A session for any questions people have on hospital pharmacy within the UK. So I asked the question for the micropharm followers on Instagram and we had 52 responses. A lot of the questions were repetitive, so with those kinds of questions, I'm just going to answer it once. One of the most common and frequently asked questions was how to transition from a band 6 to a band 7. The most important thing, I think, is to introduce the banding to you. What the banding essentially means is it determines your pay grade. If you are set within a particular banding, the more experience you have, the higher your pay within that banding. Once you move to a higher band, which is essentially another role, you will have a large increment in your pay, and then with experience within that banding, your pay will increase. A pharmacist will generally start at band 6 pay, and this will be a junior pharmacist role. So essentially the question is, how do you move from a junior pharmacist role to a band 7 role, which is generally a specialist pharmacist? The most important thing I would say is not to jump from band 6 to band 7 too quickly. Let me explain why, and this completely depends on the band 7 role you receive. So the band 7 role is a specialist role, so you begin to specialize in a particular area. Now we're seeing more and more band 7 rotational roles, but if that specialist role is only one particular area, what essentially happens is you could lose some valuable experience that you could gain within the band 6 role. As a junior pharmacist, some of the roles entail you rotating between different specialities. Within my role as a band 6 rotational pharmacist, I gained a wealth of experience and I rotated between different specialities every 4 months. What generally tends to happen is when you specialize in a particular role in band 7, you have to hone in all of your experience into a particular area. You gain a lot of experience within that particular area, but you won't have that vast knowledge or that vast exposure that you had as a band 6. Now, answering the question, with a lot of the trusts within the UK, they ask for a minimum of 2 years experience since graduating as a pharmacist. Following on from that, you also need a clinical pharmacy diploma. A lot of trusts within the UK only need you to complete the first year, so that's the certificate year of the clinical pharmacy diploma. Some trusts within the UK ask for you to complete the entire diploma, which can take 2 or 3 years depending on how the diploma is set up, and then you can apply for a band 7 role. But the large majority of trusts within the UK ask for you to have completed your certificate year and have 2 years of experience as a pharmacist. Another common question was band 6 or junior pharmacist interview tips. For this, I do have a post on the Micropharm Instagram, which will be in the description. If you are applying for a junior pharmacist role and you come from a community pharmacy background, it's very possible to get a junior pharmacist role within a hospital. For this, I'd advise you to do a few things. Look at the thromboprophylaxis guidelines. Look at what essentially is used within the trust for thromboprophylaxis. Thromboprophylaxis should be considered for all patients, and quite often there are clinical mistakes that you have to pick out within the interview process. Familiarize yourself with any drug charts, any electronic charts, how they will be displayed to you, or any paper charts, so you're familiar with this for any clinical questions you have within the interview. Another important aspect of the interview is researching the trust that you're applying for, knowing essentially if they have any extra funding, where that extra funding is going, any advancements within the NHS trust. Also, have an understanding of the trust's values. Every trust has unique values that they try to embody. What interviewers would want to know is you essentially embody those values. Once you look up the trust values, make sure you have an example of a time that you've embodied every single one of those values, so you're prepared within the interview. You may be put in different scenarios of prioritizing tasks. Display how you've prioritized tasks within your pre-registration year and how you ensure all of those tasks are complete. A common mistake that happens within interviews is that often, once people are being interviewed, they do not mention their ability to delegate tasks. Often people have the misconception that you should not delegate any tasks. Within your role, you'll be working with different healthcare professionals. It's very important to know when it's appropriate to delegate tasks, as this will allow you to complete all the tasks you need to do within your working day. Another common mistake people make is not asking for help or essentially escalating any tasks to their seniors when they have high priority tasks that need to be completed for the day. Quite often I have had people within interviews say that if they have 3 tasks with high priority that they can no longer delegate to anyone, they will not escalate it to their seniors and they'll leave it to the next day. This can be very dangerous within a hospital setting, And what interviewers want to know is that you're able to prioritize tasks, look at those with high priority, and know what to do when you can't complete the task of high priority in a particular day. So this will complete the first part of the Q&A session. I'll start working through the rest of the questions within a series of different parts for the hospital pharmacy Q&A. I hope you found this useful.